Now, with the current COVID-19 situation, we've been asked to wash our hands frequently using soaps, alcohol gel, and as a result, drying them out in the process. This is especially worse during the winter months in the UK, and we see a lot of patients in our clinic complaining of hand eczema, and this is especially worse in healthcare professionals due to frequent hand washing. In this video, we're going to explore the various treatment options we have in dermatology in the UK under the NHS, and I'm going to share my personal top tips when it comes to prescribing and looking after our patients' hands. Now, this video is mainly catered for general medical professionals such as GPs, and so it may contain some medical jargons and information. However, if you are a patient suffering from hand eczema, this video hopefully will be educational as well. For those who don't know me, my name is Chris and I am a dermatology trainee based in Glasgow in the UK. And on this channel, I share my life experience working in dermatology, sharing the things I learned, as well as my journey towards becoming a consultant dermatologist in the UK. One important tip I have for anyone struggling with hand eczema is to use the moisturizers or emollients regularly and in adequate amounts. We know for a fact that moisturizers are important in treating and preventing hand eczema. This helps by maintaining the skin barrier function by keeping the moisture in the skin surface. Ideally, patients should be advised to apply the moisturizer after every hand wash and whenever their skin feels dry. But we know that this is impossible to do so, even for myself, just because lives just take hold of us sometimes and we get too busy to even put creams on. A more practical approach is to advise patients to keep a small tube in their bag when they go to work or school, and also a bigger pot to use at home. From my experience working in dermatology, I realized that a lot of patients run out of their creams and ointments. And so if you are a healthcare professional watching this, make sure that you prescribe large amounts of emollients or moisturizers for your patients. So instead of giving them a small tube, 30 grams, 100 grams, go for the big tubs, 500 grams. Another important tip when it comes to prescribing moisturizer is to consider prescribing ointments rather than creams or lotions. Now, ointments contain a higher oil to water ratio compared to creams and lotions, and this means that they would last longer and will probably be more effective. They are, however, greasier than creams and lotions, and so patients may not like it as much, especially during the day when patients use their hands a lot, and so it might not be very comfortable. What I generally do for my patients is to advise them to use a cream-based moisturizer in the morning when they're out and about, and to use a greasier ointment at night. It is important for us to advise patients not to smoke around their moisturizers, as a lot of them are flammable and can be a fire hazard. If using a tub rather than a pump dispenser, it is also a good idea to use a clean spoon or spatula to scoop out the ointments rather than using the fingers, because you may introduce bacteria and infection into the tub. The next tip we have is to use cotton gloves to keep the moisturizer in place and makes the whole process less messy. I often advise my patients to put their moisturizer on first and then wear their cotton gloves on top before going to bed. And this really locks the moisture in and really hydrates the skin as a result. Another pro tip is to use zinc oxide bandages like Ectopaste and Viscopaste. Now, these bandages, as well as the cotton gloves, are prescribable under the NHS in the UK, so please consider using them. Viscopaste contains 10% zinc oxide, whereas Ectopaste contains 6% zinc and around 2% ectamol. Now, zinc has anti-inflammatory, antibacterial properties, and ectamol has anti-itch benefits. What you do is you can cut them up into little strips and roll around the fingers or the affected areas. Subsequently, you can ask the patients to wear cotton gloves on top to keep everything in place. Another pro tip is to use a good soap substitute rather than harsh soaps or even alcohol gels. Examples of this would be Dermo 500, QV Gentle Wash, and Hydromol ointments. These soap substitutes are gentle to the skin and makes it less prone to further irritation and dryness. Now, Just for your information, Dermal as a leave-on moisturizer can be quite irritating to the skin as it contains ingredients such as benzalkonium and chlorhexidine. So in dermatology, we don't necessarily prescribe it as a leave-on moisturizer, but rather as a soap substitute. Now, steroid treatments are sometimes essential when the skin is particularly inflamed. We would usually start off with a strong, potent steroid, such as Dermovate, Alocon, and Betnovate, and we would go with this for maybe 2 to 3 weeks before tapering it down accordingly. The reason why we go for potent steroids in the first instance is because the skin on our hands are generally quite thick. We also go for ointments rather than creams because ointments are, as I've said before, longer lasting and more effective, and they have less ingredients compared to creams, which makes the skin less likely to get a reaction. For patients with hand eczema who have quite severe cracks or fissures, sometimes a good tip is to prescribe these steroid tapes like fludroxycortide tape or betamethasone tape, and these again are prescribable under the NHS. Again, this will only be for a short duration only, as these steroid tapes are steroid under occlusion, which means they are more potent in strength. There are of course other treatments available in secondary care such as UVB phototherapy, aka light treatment, and other systemic medications, but we generally treat patients quite well with just topicals. Last but not least, you may want to consider potential contact allergens. The main common type of hand eczema is what we call contact irritant dermatitis or contact irritant eczema. And as the name suggests, it is due to irritants such as water, solvents, and detergents. Now, these are things that can cause irritation to the skin in everyone, and so they are not a true allergy, but rather an irritant. However, we may wish to consider potential allergens in patients who have quite severe hand eczema and who are exposed to chemicals regularly or who are involved in wet work. Contact allergic dermatitis or eczema is a delayed allergic response to a potential allergen. Now, this typically happens a few days after exposure, and it can be quite persistent despite topical treatments with moisturizers and steroids. Common substances include things like nickel, fragrances, and rubber gloves. So if you find that your patient isn't really getting better despite potent steroid treatments, then you may wish to consider contact allergy as a cause for the hand eczema. It is very important to take a focused history, looking specifically into their hobbies and work, as it can reveal a lot of things. And if we are suspecting contact allergy, then we may want to do patch testing in secondary care. There you have it. These are my 5 top tips when it comes to managing hand eczema. If you like this video, please click the like button and subscribe down below. Thank you for watching once again. See you next time. Bye bye.